Hey everyone, it's Jordan with Trauma. I'm gonna run over the ThermaCor with you guys. This is our rapid infuser. It will rapidly infuse blood, fluids. If you have a large enough line, it will go about 1200 cc's per minute. It will also warm the products for you, which is really nice, as long as you have it plugged in. It does run off of some battery power, but it will not give you that heat, which is really nice. A couple of things with some contraindications to this. I will not put cryo through this because you don't want the cryo to get warmed up, because then you lose all of that good coagulation factors in your cryo. You do need to have a good IV for this. 20 gauge is usually the minimum. What's nice about this machine is it will detect any of the resistance against that IV. So if it is through a precarious 22 in the thumb, it's not going to push that fluid at 1200 cc's a minute. It may go at a much, much slower rate. So you're losing some of that rapid infusion piece, but then you're not losing your line. All right, so really indicated for patients that you need to quickly resuscitate with blood products and some volume. So you're gonna grab your rapid infuser. We have these in a few areas. The ED, the STICU, the MICU, and also your OR is gonna have a ThermaCor, and OB has one as well. You're also gonna grab your cassette here. This is gonna be, call it a suitcase. It's white, large, and a little heavy. So you'll bring this to your patient's bedside and whatever your product is, blood product or fluid. Opening up right here, you're gonna have your clamshell. This is piece number one, it's the cassette. You're gonna remove this. And you're also gonna remove your two sets of tubing, all right? One is blue, one is red. They really tried to make the ThermaCor easy by making it color-coded. All right. If you guys can see, I have here, I've got a couple of different spaces. So I've got 3 places that I connect all of my tubing to. I have a yellow, which is for air, fluid is the blue, and then blood is for patient, or red. Let's hook up our triple spike. So you'll have 3 options for fluids and or products. I like to just, as I'm setting this up, clamp these, because if you don't, you're gonna have a mess on your hands. So clamp them. It really does take 2 fingers to do that. This is the filter. This is the piece that if it gets wet, the whole thing really doesn't like to work as well. So I always try to make sure that this piece does not get wet. All right, and then it's pretty self-explanatory after this part. I take my filter, or excuse me, my cassette. It is heavy, y'all, so just be warned of that. Take off the blue, take off the blue. These 2 clip together. This piece right here on the yellow comes off, as does this bluer lock. These come together, okay? So this is what is gonna administer the fluids. You like to have it like so. Again, I like to go ahead and clamp this piece as well. And then finally, you're gonna take your patient tubing, and that's gonna be the red patient line. Take this red off, take this red off, and then it's a white to white. So even if someone takes all the caps off without you knowing what goes to what, the white to white go, it's an opaque to opaque, and then it's this yellow piece right here. This, I get out of the way, go ahead and clamp it. It's what I'm going to be putting into my patient's large bore IV. This piece is set up, ready to go. I sometimes do this off to the side at a table because it's easier if I can lay this flat. Next is I'm gonna come over to my ThermaCor itself, all right? I need to get this piece off here that says do not trash. This piece right here is just a protector of the innards of this device. Unlock this piece here using this red bar, and this should fall off like so. Kind of easy to see it on here. These 3 holes right here line up with these 3 holes. So that's when you put your cassette on, that's what you're looking to line up, is those 3 holes together. This, move it off to the side. I do not need it while I'm infusing my patient. All right, open up your roller device, and then go ahead and let's turn our machine on. Press and hold your power button for about 3 seconds, and it's gonna do a little couple of clicks, and it's also gonna give you some prompts of what to do. The first one is going to tell you to no cassette. Also, it says heat is off. That's because I don't have it plugged in right now. Completely fine. All right, now I'm going to be taking my cassette here, which I have not primed with anything or hooked up to fluid, and I'm gonna rest it down here on this lower bar. As I look at it, I can see when my things are lined up. All right, so I think that I've got them mostly lined up here. making sure, this is the hard part, to get all of these cables out of your way, pushing this roller tubing to the back wall. And then here's the hardest part, I think, of this whole thing, is getting this thing locked and over. Push right here on this top left piece and push your bar all the way over. It takes 2 hands to do that, okay? This piece is gonna go up here with my fluids, okay? So I'm placing my fluids up on the bar like so, and I only like to start priming it with 1, all right? Oh, there we are. So do y'all see how this is kind of hanging down and it's in the way? A lot of times I need to push this up so that this is nice and one long piece like so, okay? Everything else is still clamped. I will unclamp my blue piece here, and you can go ahead and close your roller tubing, all right? Again, this is gonna give me some prompts. The first thing that it says is unhook patient, press prime. Because I need to prime all of this tubing with fluid, I certainly don't wanna give my patient all of that air, all right? The prime button down here is beeping. That's nice. Press it. I like pressing buttons. This is doing an auto prime. All right, making sure you're unclamped up here. It is pulling the fluid down into my Buretrol, down into my fluid line, and it's priming the cassette. A nice thing about this device is that it does not allow it to go dry, because it's always going to have something inside of that cassette. All right, so paused must be because this device is all primed in through here, okay? So I'm going to again unhook make sure my patient is not hooked up. I need to prime this part here. So unclamp. Another troubleshooting thing that I come into with this ThermaCor, this red patient line here gets kinked very easily. So a lot of times what I'll do is I'll pull it over the machine like so that it doesn't have that kinking. All right, so if you guys can still see, now I'm ready to press prime, and I'm holding it this time, okay? All right, so we're just making sure that we're priming all of that cassette. Oh, I see some of my fluid is coming down into my line. So I'm gonna continue it until I get it all the way to the end. Notice how it's much slower when it gets to the patient line. All right, and there I go, get that big bubble out, and now it's all primed. That's how I prime my ThermaCor. Simple and easy, right? It's ready for use. Remove this final red cap, hook it up to your patient's large bore IV, all right? Which is gonna be inside of that bag there. Okay, all of this is ready to go. Again, triple check things. I've got fluid hanging up here. I've got everything unclamped here. This piece is unclamped. This yellow piece right here is going straight up into my Buretrol, and it's venting out all that excess air coming down in here. We're ready to start with the patient. There is a button here. It's called Rapid and Start. So Rapid, Start. And now I'm rapidly giving my patient whatever the product is. And we're very, very rapidly giving this stuff, so I'm gonna go ahead and stop. Right down here is you can start to see the selected and the actual. So when I was rapidly giving it, you'll see how fast it's going. I am going at 500 mils per minute. Okay, so let's go ahead and stop that. Some other things that you can do if you don't want to just rapidly infuse all of this blood or saline to your patient, you can go slow. That's fine, and it will default to 120 mils per hour. All right, so slow mils per hour, rapid mils per minute. Just keep that in mind. It's gonna go really fast. So if you're giving fluids to your patient, please note that you can give 4 liters of fluid to a patient in about 3 minutes. We don't wanna do that, all right? You wanna give blood that fast. You don't necessarily wanna give the fluids that fast. And that's it. That's as simple and as easy as the ThermaCor can be. It is color coded. You put all of this on, rapid, start, you're good to go. And that's your ThermaCor. Thank you.